That's such an interesting question because it's called eosinophilic esophagitis, right? Like, eosinophil is an allergic cell. We see that early on in the EoE story, it was always this allergic disease, and now obviously gastroenterologists, because of the endoscopy part, are so much in the game. And so you kind of see there's differences in different parts of the country too. So some institutions, the GIs really run the show. In other parts of the country, the allergists are really the primary people. But and then there's some places where there's very equal GI and allergy involvement. I think when we think about EoE, we can't not think about the atopic comorbidities that exist in a lot of EoE patients. So, food allergies, eczema, asthma, for example. And so, we think that the disease is kind of very similar in what's causing it, but we don't totally know. But we know that EoE patients often have these allergic diseases, and so um, the care of diagnosis of EoE, kind of picking it up, and also picking up these other atopic conditions, is really does kind of involve a partnership between allergists and gastroenterologists. Um, a lot of times, like, sometimes people with complex EoE, if they have a lot of other atopic diseases too, the control of the EoE, isn't may not be perfect or optimized unless you control the other atopic diseases. So working with the allergists, is very important, kind of discussing, what therapies could we use potentially to treat all of these things at the same time is kind of a nice space we're in too with a lot of the emerging biologics. We think about other interdisciplinary management. I also think about dietitians, so patients who want to do food elimination, empiric elimination diet for EoE. Partnering with the dietitian is almost, it's a must for me, just because I'm not super expert in knowing all the foods that have soy, for example, and how to walk patients through reading a food label. I'm pretty good at it, but not the best. To know where dairy hides or where wheat hides, and the very elegant steps of the empiric elimination diet. So partnering the dietitian is so instrumental to making the diet therapy really succeed in implementation. For kids, I think feeding specialists, as kids kind of, learn how to eat differently with their EoE, but also relearn that process as they grow older. And then finally, I think we always kind of we think past this a little bit, but the importance of GI psychologists. A lot of patients with EoE, they've had their symptoms and their disease for so long, and for a lot of patients, that symptom burden is very, very intense and significant. And so, how to, even if we get the disease into remission, a lot of patients still struggle with hypervigilance or kind of feeling like the symptoms are still there because they've kind of modified the way they eat and they've made so many ways to cope with their disease. But how do we move past this into remission? We've gotten the esophagus cooled down, how do we still move forward to, either liberalizing your diet or existing in the society around us or all around food? And so GI psychologists are also very, very significant when it comes to really taking a very multidisciplinary approach to EOE. Yeah, I think besides just so many growing therapies, it can be, I always tell patients having so many different therapies and and being in the space of a new disease is exciting, also frustrating sometimes because you have so many different choices. But um, just having different therapies to kind of choose from in the future, it really opens up new doors in terms of like where we can use to treat the disease. It teaches us so much about what's causing the disease. A lot of patients will often ask me, "Hey, do I have to use this for forever?" And I say, "Well, we think that EoE is a chronic disease, at least now, um, and that requires chronic or forever treatment, but that may not be this one treatment. So that could change over the years of knowing about EoE and having EoE. I think one of the very interesting publications that have come out is the ACG guidelines that were just published in January of 2025, so this year. And they take into account a lot of recent evidence about the different therapies. But a really beautiful part is that there is this big table, a big chunk of the guidelines that take into account the practical points of like how to use the medications. So it's one thing if you kind of present all the very intricate studies and the data and the evidence, but how do clinicians practically use these different medications? What are the doses? How to use the topical steroids, when to use which one versus the other one. and when to think about intensifying to kind of more aggressive therapies. And so, I really like how the guidelines take that very easily digestible, practical points just for clinicians to just take care of patients on a day-to-day basis.